ngofo le bango fao ai apo le mangori ma ko le weiful se ungal monga pioa ai ka o ko le aka ka le mangolava il malao nganga moe ma de fanga ma fanga loa il lauiu sai loa ko longola fa kurkuru kao ma fa kurkuru mbona ko longo sa mo ma lo fa la loa ma ya le ka fungua o le ka sawa i malai kele ma malao va sei pa ia le si fungua le ala kawa i filima puruku ya sua ma vai fungua fo mai kulangi i ku au mala kawa sa ole ma le laungiu sai loa fio fo le lau ngā mukas le fio fakui ma lau vaa koko o whari ula ma upu ya ke oe le mungua kele a le ngalo a fia songa vaa wara kapu inga ya ke oe pula mkumua kama mainga a inga o laku kama a ka ingange le vaa fonki ma le ko o fua ma ko ki whakulou nge kulau le asu. A wana mako wa feo mau ke malawa. O nga kulanga de malo, a wa se sila fia mangingo. Ma se sila fia ko koa o kaku aku ngu. A walo pea ni tatu atu nu ma le malo. Ia. E po pea le fala ma tapuai. A kawangu wa fea i le kafu kolu malo mo lang sase kolu. Le fio le ao malo la fonga ko vangsili a ke ngare le paia ingor moka el moka sen ko el moka sui ia ka ngare malu ia ki ere le fam singa ia mal senga fam singa pa per malai lo ko fale e ke ol ka sa mo e lo fonga mabukas li fal penga mal malu pungu le ma ko ke whakulo, ma ko ke whakalo whakulu nge kula le aso. Ia o ngā kula u lea ua fuafuainga. A wana mapu pua lea. Le whiwaku, ma whakasi mai la whioka ni lukenga ko vanga. O ngā kulanga lea ua ka oko. A wanga luenga fo mai mari im ka mai kai fo mai. Ia mo le sila fia mangingo. Ia ila mamadu o le kaku atunu. Ia ila ngai kaimi. O ngau whangaso longa o malanga lo e keimini ngei. Kulanga o kou sila mai. Ia, de lea whioku le songa lukenga. A lafa kunga. Lea lo waa fo laukasi. A waa kua, i uso a kua, i waa kua, ia maa a kua. Ia, ila songa lukenga ko vanga. Ia karo wenga. Lea fo ka kou ki whakasiai male. Sui mai le kumalo fo. Ia, sunga ia Sandra, me ando Samoa, ia, makamai kai fo mai, ia, sausi keimi ngā bakule, ia isa wangoa ku, ia e wha mangingo ai ku langa o le kako wha moi, ia, vange, le pa ia fore lau suako o lau whasara lau, ia, wa fore la kou makanga ruenga, ia, i le keimi, me lea, la bakule ngea wangoa, ia, e sunga kamai kai fo mai whabikoa, ia sunga ia lauvao, takto lauvao, ia foi kei moinga de kaku whamoi ia kusai mar kulanga de kaku aso. Ia, takto lauvao, balwharalo.
Ia, whawhitaima la wanoa, ia whiwhatalo whatu fo i le sunga lutene kovana po le car, whapea whata si mai netai au. Ia wa fo i sila silanga le mutanga luenga o soifua maloloina o na nisi o fofuanga e me sila malanga lo o no fo isia nei e me nisi o tulanga pe o tui pui puia e me se fo i whamala maina o le whamai lewa pepesi fo i nei o le a fo i o le RSV ma le tai au nei e se whailoa momoa sulmato o waa o whaapea whata si mai le nei tai au ia ilo i tū tamatau mua o Dr. Aifili Tufa o ia leo le Territory Epidemiologist. Ma o ia foi la amataina, ia foi la sanga matanga venga so foi malolo ina li nei tai au. I tala atu o ia Dr. Kayapa Maria, mai whai mai tele OBJ, o ia foi la whapea whaasala noa ina le wha mai lewa ia temi nei o le RSV. so atu ai ia Dr. Francine Amoa o ia o le pharmacist ma o ia fo'i lo tsaitsa ia committee o lo faia tui pui o le COVID-19 ia utafa Francine lo ia Dr. Fiona Trail o ia lea lo va ia i le quarantine ale matanga luenga so fu maloloina ia so atu ai ma Dr. Losana Natuva o le tasi leo matofo mai fa peo na haia ne tausanga ma o ia fo'i lo sosoani i le quarantine vai taimi nei ia ma tama ita i o le iema ia o ia o le representative at CDC na amatu o le amata o le fasolonga la taso polosanga nei tai au o nei afiafi amata Dr. Aifili tano atu i fofuanga me o mo tupu COVID-19 ona so o ai leo o Maria Kayapa tano mo fa mai o RSV ia fai o Dr. Francine Amoa la tano ina i fofuanga o le tuinga COVID-19 mo lo uava la fafatai
Whaftai mo lewa noa, ave fo nei taimi e whatalo whatuai le pa ia mal malo le tatu atunu, o lo o mai moa mai nei tū lao le aso. O se li poti lata mai nei, tu sai fo i ma le tūlanga o lo iai ia le tato au whainga malanga le sa tau nu o mai le aso lua sulfitu o le maasina lena te atu nei o Ianuali. Lua se lau fitu sfurufao i la tau sa tau nu mai mal manuia, ia e se lau iwa lima o i la tau o whaanufo i sea nei le trade winds, lua se fululua i la tau o whaanufo i sea nei le alternate care facilities o le facilities ia i tāwhuna, ia ai lima se fulu ma le fitu o i la tau o lo whaanufo i sea nei le whatu ainga. O le suenga mua mua ma taulia fo i le pa ia mal malo le tunu, ia e tau lava o na whaia suenga le au whainga malanga, ina ia whaai loa iei po le mea o maile au whai malanga, maile le vairusa i nei pe le ai. Ia o le suenga mua mua, le sa whai le aso muli muli o Ianuali, le aso na fua le nta te atu nei, le aso toru tasi, sa sue aia, sa whai suenga mo i la tau uma, le lua se lau fitu surfa le au pasese. Ia o maua mai results o tato suenga ia, e toa wha ia positives na maua mai ai. Au le toa wha lea, toa tolu o le au whai ngā malanga. Ai toa tasi, ia, o le au whai ngā luenga o le quarantine. Ia, ina ua maua i maia results, ia, ma aveto o le la tau e whaano whisea i tato isolation facility i Tāwhuna. Te minei o lo o malosi pia i la tau, e le inisi o alia i mai ni aunga o wha mai. Ia, o suenga longa lua, lea sa whai le aso lulu, po le aso lua Februari. Le sa te atu nei, sa a mata mai le ASACF po le Alternate Care Facility Tāwhuna, ia whapea fo i le whatu a inga. O saiti e lua, sa whaile suenga mua mua i le aso lulu, ia o results e maua mai, e to o fitu la tau, sa whapea sa positive mai le Alternate Care Facility Tāwhuna, ai to o valua i la tau, sa positive mai whatu a inga. Ia, ina ua whai nisi suenga, ia ma whaatala noa fo i le au pasese. Ia o determine o le toa fitu le mai le ACF, ia whapea fo i toa valu mai le whatua ainga o i la tau ia sa maua mua i le whamai o le COVID-19 ai le imalanga mai, ia o la tau la ia le ua consider nei o historical cases. O le isi o le suenga longo lua mo le Trade Winds Hotel, sa whai le aso ananafi, le aso tofi, le aso toru lea o masina nei o Februari. Ia ina ua maua mai ia suenga, ia o le se lau iwa sifuru lima le upasese, e to o lua sifuru tolu i la tou sa positive, ia na maua mai ai foi, e to o tolu foi le au staff o le quarantine, sa positive ai foi. Le to o tolu la lea le staff o le quarantine, ia le ua vatu la tau le isolation facility Tāwhuna, ma ua wha no wha se ai la tau i nā. O le lua sifuru tolu leo pasese lea sa positive, ia e sifuru wono i la tau sa e wha maunga, sa la tau a fia e wha mai, ai le i malanga mai sa taimi lata mai nei, ia au i la tau fo i la le ua consider nei o historical positive. O le si toa fitu, ia o lea lo wha au pea suenga temi nei ina i loa atili ai. Po le mea sa a fia wha mai ai le malanga mai nei. Ia ai tu watu si lipoti pa a whai o mai results. Ia o se lipoti pu'u lea, ia lipoti lata mai nei tusai fo'i ma le tulaga o lo'o iai le faigamalaga I le tatou nofo ia fale quarantine sites, ia ma le avalava faafetai. For our English speaking viewers, I would like to say thank you and good evening or welcome to our press conference. Would like to give a short update with regards to our flights that arrived on the 27th of January. 274 passengers arrived on the 27th, and right away they were taken to our quarantine facilities at Tradewinds Hotel here in Oroville, our alternate care facilities in Tafuna, and also the Fatu'āinga buildings here in Oroville. 195 are currently in quarantine at Tradewinds. 22 travelers are at the alternate care facilities, and 57 of them are currently being quarantined at Fatu'āinga. So with every flight that comes down, we want to make sure we do a good tests of all passengers to make sure that we can identify any possibility of the virus coming here so that we can take the actions to try to protect the virus from seeping out to the community. The first test was conducted this past Monday on the 31st of January, and from those results, 4 were tested positive. Among the 4 that were tested positive, 3 were travelers, and 1 of them was a quarantine staff from one of the quarantine sites. All 4 individuals were immediately transported to our isolation facility in Tafuna, where they are currently being held right now. No one is symptomatic at this time. They're all fully vaccinated and are in good health. The second test was conducted in sequence. The first a series of tests were conducted for those at the alternate care facility at Tafuna, and then also at the Fatu'āinga buildings. From these tests, 7 tested positive from the ACF facility, and 8 tested positive from the Fatu'āinga facility, for a total of 15 from that second test for these 2 facilities. And after further investigation and other testing, all 15 of these travelers were now considered historical positive, which means that they contracted the virus within the 2 months period before they traveled to American Samoa, and currently they are now considered historical positive cases. They are still currently in quarantine. They're fully vaccinated. They are not symptomatic and are in very good health. The second test for all travelers at the Tradewinds Hotel was conducted yesterday, Wednesday, the 3rd of February. And after doing the tests, 26 positive results came from that test, 23 of which were travelers, and 3 of them are the quarantine staff there. The 3 quarantine staff members have been immediately removed from the quarantine site and are currently at the isolation facility at Tafuna. They are all fully vaccinated and are currently in good health. For the 23 passengers that tested positive from Tradewinds on the second test, 16 of them, after further investigation and testing, are considered the historical cases, which means that they contracted the virus within the 2-month period before traveling to American Samoa. The other 7 travelers, we are currently conducting more tests, and we are still awaiting results so we can determine whether these are historical cases or recent infections. When these results are made available, we will report them as soon as we can. This is a short report from the quarantine sites and our travelers, and thank you for the opportunity.
I would like to give an update on the RSV status from the side of LBJ Hospital. As we all know, RSV is the name of the virus that's affecting the community at present, mostly affecting the extreme of age groups, the young ones, and the senior population. The incidence of this virus for the past 2 weeks that's coming into our clinics is affecting 85 to 90% of cases, mostly with respiratory syndrome. There is a high admission rate among the ages less than 2 years old. The indications for admission for kids who have RSV or are afflicted by RSV are shortness of breath and poor oral intake, or a failed outpatient management when we give them some medications and apparently their symptoms are getting worse. Now, I would advise coming into clinic only if you have signs of shortness of breath or poor oral intake. Now, if your kids have more than 3 days of respiratory problems with high fever, with decreased appetite, then it's an indication for you to bring your children to pediatric clinic or emergency room. Now, if your children have only simple complaints of 1 to 2 days of fever, cough, or runny nose, but remains active with good oral intake, please stay home, hydrate your children, give Tylenol or fever relievers, or if you are in any doubt, please call in to our clinic. We have 6 pediatricians on board to take your phone consultations. Remember, RSV is transmitted by respiratory droplet. Now, we are aiming to divert patients away from the hospital because this disease is highly contagious. So we are trying to avoid other people like the adults who are sick in the emergency room to be exposed from children having RSV by having an extended hour clinic, which happens on Mondays, Fridays, and Saturdays. Monday and Friday clinics are located at Pediatric Clinic, running from 4 to 8 in the evening. And then Saturday, the schedule would be from 12 to 4 in the afternoon. You have 2 physicians to accommodate the patients. This clinic will be called a respiratory clinic, only addressing respiratory problems among children. Other conditions that you would like to bring your kid to, your entry will be emergency room. So that's from RSV.
Thank you.
Thank you. Mo le whamalamalanga le RSV, mo la tō le mo la tō e whaangaina le ngana Samoa. E leo whautua mai fōma ia Dr. Kaiapa mai le whale mai. Mo tō tele a whanau o atu le whale mai, o na o nei wha mai. Ma o le tele fo i la tō tauwhia, i lalo ma le lua tau sanga, o lo tauwhia nei tōno le whale mai le poto lo tauwhia i tamaiti. Ai, o le mafo au tauwhia, o na ua Top mana wa tamaiti o le mawhai o na aipe whaina inu i whale o mawalunga fo i le vevela o tina po le whiwa. O lea walai o na le mawhai o na tweet tamaiti e a fo e tweet loto ainga. O lea walai na mawhai o na tau fia. Ma o lo whautua ina mai fo mai, mo mātua, mo whanau fo i le na le tale tawhile isu ma whiwa alai o lai e a fo i le leile ai e lai fo i ta alo pe ta mo i tono whale o whanau la na lo whautua mai fo mai e a wande watua le whale mai. O le watua le whale mai nei whanau na tau whipe le whale se wanga nā. O le leile mana wale ta mai titi po o le mawhaina ai mo le mawhaina inu o na whaapelo na watua le whale mai. O la mafuanga o la tamo fai ya awani o atu fal mai ona fa mai le RSV e pe pesi tele e fa ngofia na pesi e fa na uma tangata uma le atu tono fal mai ma lo fai lo mai foi o fa pe ona fai se tsala vai i fal mai e va ia to inga mai fa pe nei na tangata la mo fa mai o le mana o fiva o le faina lo vai la to i le asonga fu ma le fa leile i le fai le valu le fiafi e to lo la fo mai la iai o le fōma i mani ER, ma wha pēr fōma i o tamaiti. O lo whau ina fōi tala vai le las tō nai, ma le sifuru lua le aluri e o le wha le fiafi. O no le tamo whai ina ia wa aina i whanau mai la tō o wha pēr na whai ina i wha mai le RSV. O lo wha pēr fō i la o na fiso soani mga lue wha tasi le matanga luenga so i fō malolo ina mal whal mai. O lea fōi wa manatuai, o lea so lua mana stofi i le wha i le valu le fiafi. Lo wha pēr na wha o ngā ina le clinic le tafuna o tafuna primary clinic o la fa pena fo na va ai na o mai ai o fa pe wo atu o fa pe na mo la tu le RSV o le la fa ngai fo ila o ma so swani le LPJ nei ma fa no ma tanga lo fa tsasi nei ma fa o na va ai pe abatu fa na wi po tanga tama tu fo e va ai fo e ma to la so lo ma stofi au le LBJ le sunga fua mana se falele ai me se la sto na ai ni sfesili o lo fasalo mai wala au atu fale mai pe wala au mai fo il matanga ngwe so fo malolo ina ile command post ile lota siva aftai
Malo.
Malo soifua, malo le on sai. Molia te foi lengang faftai tu sai fo imale tapo inga. Au fa solo pea ta te nga luenga I tui pui pui o se famtalanga lai la te mai nei. Lengang fie fa iloa tu ei o le taimil nei. O fitus e fulu iwa pasene. Fitus fulu iwa pasene le au fa i o I tātou nei. Ua mai a uma tui pui pui o le COVID-19 fulu iwa. 79% le tātou coverage lea for the COVID-19 vaccines. Ma o le tūlanga lai le whanau a onga. O le whanau a onga le au whai o tātou whanau a onga leo ei nei. Ova ma le sfulu lua afe le whanau a onga pe atu whaatasia tātou a onga private ma le public schools. O le pasene fo ila o ila tau o mai atu I pui puia. E fitus fuluiva te sima le 5%. Fitus fuluiva te sima le 5% o mai atu I pui puia. Ma o le whanau la iti la 5 I le sfulu tasi tausanga. Beuna silofia le atunuu o I lātou nei le 11 na whaatanga mai lātou e whaia lātou tuinga. Ma e ova ma le 5 afe mono tupu I lātou ua mai a le tui mua o lono winga o lo iei lava I lātou e le I whaia le tui lona lua. Wha afe mono tupu o uma tui e lua. Ha o lo iei lava I lātou e le I whaia a lātou tui lona lua. E tau sanga twaila I mātua. Tanga ia ai tui pui puia, o le pepa tui pui pui al whanau. Na o mia lava na o mai, wha uma tui longa lua, pe a whai wadu le lato tui longa lua. Ma o le mafuanga fo I lea wa ai se manatu, e le sunga al whatonsili, ai mai se I mātou nei le ofisa soifua maloloina, whata sei ma mātou paanga e le ofisa wa o onga. Ua mana o mio na toi watu I tua I a o onga, e toi wha wau le tui inga al whanau. On o le nau ta inga ina ia mai a le leia lato tui pui puia. O aso lai nei ua whaatulanga I toi o atu e tua le mtanga alwenga o le masina nei o Februari le aso sfulvalu, Februari le aso luafultolu, luafulima, ia whaatasema le luafulvalu. Peona silafia o le aso luafulvalu la whaamuta e le tātou se lauta alale tufa, pe a pe whaatino tui pui puia a le whanau. 5 I le sfulu tasi tausanga. Tausanga twaila I mātua. Aia tātou pepa I saini consent forms. O le amata na tufa atu le vai aso fōu. Ia sainia mai a tātou pepa. Ia e manatua o le whanau 5 le sfulu tasi tausanga. Mana o mia lava le awai o mātua ia o onga. Ai le whaia lātou tui pui puia. E saini pepa. Ia msosoa nia I le au whainga luenga. Awa le whaatino I no tui pui puia al whanau. O a tātou booster doses, mantua o a tātou tui nei lona tolu, o le tui whaopopo lea, whaamalosia ai a tātou tui mua ma le lona lua. O tui la o le Pfizer ma le Moderna, manatua e lua vaenga o tui nei, ai a whaapea wa atoa le 5 masina, talu na whai le tui lona lua, ua ngā wha aloa la mo le booster dose, e tatusa lava ma lau tui mua le na whai. E mawhai foi o na whaangale Moderna po le Pfizer mo a tātou booster doses nei. A whaapea na whaisau tui o le Janssen. Mantua o tātou tui lea na o le tasi lava le tui. Lua masina talu na mai alo tui le Janssen. Ua ngā waa foi oe mo le tui pui pui o le booster. O le taimi nei le whaamai leo le Omicron. O le vaenga leo le coronavirus. O lo maua mai ni whaamau ngā mai atu nui whafo. O lo pepesi e le whaamai. E mo I lava o tui mua ma le tui longa lua, awa mana o mia foi, ma o whaamaunia le tā ua o le tui lona tolu, o le tātou booster dose lea e whaamalo si ai le te atu I le pepesi o le whaamai. Pei ona tā ua I nisi o le au whainga luenga, o lo iei nisi o whaamaunia o maua I le whaamai, positive cases. O I lātou umanei, ua mai a tui pui pui e lua ma le longa lua. Ai peo na tātou wa ai mwha alongolongo o lo saofia mai lava le whaamai I lātou. Mafuanga lea tausanga tuai le ofisa a fai ua oe i le taimi lea fai e lau tui o le booster. Lima maasina talu na fai lau tui longa lua. Ia, wan mea na su mai fai lau booster. I vai aso fou o lo ava noa pea tato no fuanga o tuinga i whanmai tu malo. Ai tanga i lei lau tui, a whape o silingia le taimi fai lau booster dose, wala au mai le ofisa o le lua tasiiva. O nisi whamtalanga fou mai fafo, o le tato tui pui puia leo le Moderna, sa whaatali po o le mea FDA approval, ma o whaamanuia la le company nei o le Moderna ua grants ma iai po ua mawai lato full FDA approval status. O se tala fia lea o sa fasilingia po o a fia tonwe mawai le approval tui lea ia a lea lau mawai le vai aso nei. O se whamtalanga pupu na ia tato tui pupuia e moli te lea tui ngang whaftai tu sai fo e male tapo inga au whanga solo pea tato ngaluenga i tu langa o tui pupuia. For our our English-speaking community, thank you very much for tuning in this afternoon. Would like to update you on our COVID-19 vaccines. I'm very pleased to share that 79% fully vaccinated is our current coverage for our total population. 79% fully vaccinated. So this is very good news because we are getting very close to our target of 90% or higher. With regards to our school children, our school-age population, currently we have about 12,000, estimated 12,300 of our total enrollment in both public and private schools. And also pleased to share that the coverage there is about 79.5%. With regards to the 5 to 11-year-olds, as you remember, this age group was recently approved for the vaccine. They were approved in November. And so their coverage, I'm pleased to share, over 5,000 of them have received first doses, which means about 4,000 plus have completed both doses of the vaccine. And so because they are not yet at 100% coverage, which we would like, the Department of Health has now scheduled a return to do the school-based vaccine sites. We have scheduled for February the 18th, 23rd, 25th, and the 28th of February. The 28th of February, if you recall, is the last day for our $100 cash incentive. So want to remind all of our parents out there, please don't forget to bring the children in to get the vaccine and claim the $100 cash incentive, because right now it's only for the 5 to 11-year-olds that can get the cash incentive. Regarding our booster doses, right now, if you have had your second dose, meaning if it's been 5 months since your second dose of the Moderna or the Pfizer, you are now eligible to get your booster dose. If you had received the Janssen vaccine, 2 months since your Janssen vaccine, you are now eligible for the booster dose. And I'd like to share that the data we are seeing from other countries, countries where the Omicron variant of the COVID-19 virus is now spreading, they are showing that if you have the booster, that increases your immunity and decreases the ability to spread the infection to others. I know earlier we talked about the importance of the first and the second dose, but as we learn more and as data comes through from other countries, we are learning and we are following very closely. We strongly recommend that if you are due for your booster dose, meaning 5 months after your Moderna or your Pfizer, 2 months after your Janssen, please come in to get that booster dose. Other important updates from the FDA, the Moderna vaccine, which was still under emergency use authorization, is now fully approved by the FDA. So we are very pleased to share that information because both the Pfizer for 16 years and older and the Moderna for 18 years and older are now both fully approved by the FDA. Thank you again for tuning in. That's all I have for the COVID-19 vaccines. Thank you.
Ia nau whaafonga me le tinu ui wholesanga le tanga ruenga sofu malolo ina. mata upu pe ona whaalaulau ina atu. Ai mei se le tatou waalo no fo se nei I le temi nei ia pe to fasila sila atu ia so tele a I lato o saufia mai whainga malanga o whapea ona o positive mo le COVID-19 ia le talasanga atu ai pe ona talasanga mai le tatou Francine e se tau ona whai tatou tu puipuia ai tatou ai mei se lava le booster dose nei mawhaina puipui tatou mai le nei wha mai o le COVID-19 o le sifo I mea lo tupu temi nei, yon whasala wa so lo iai nei le wha mai lo pesi o le RSV. Ia, te le fo I mea tawana whai ma puipui ai whanau, ai mei sei la tau whanau laiti, I le wha peona ngā waa mo le tui puipui o le COVID-19. Le fo I talo sanga toi le matanga luenu. Ina ia wha peona tasa ngā lue whatasi, ina ia o mai e whai o tau tui puipui, ai mei se ale booster dose. Ma le a fo I, ma isi fo fuanga le matanga luenga, wha peona whasala wasu ina ima whai o tatou ngā lue whatasi ina ia malu puipui alo tatou atu no mai le wha mai le COVID-19. Ma le taimi nei la atu ina atu I le sunga le car po le Lieutenant Kovana. Wa fo isa na saunoanga I mata upu. Ia manisi fo whasi silanga mo le tatou atu no I le nei tu la whakatai lava.
Aftai mo lewa noa e whatalo whatu I le malu o tatou atu no mwhai ona mo mai nei whasa launga I nei foi tu la le aso ia talosia o lo sol manuia pe o tatou atunu o le anganga nei fa moe ina ia lausila fia tatou atunu tulanga foi wa iai le fa mai le nei vai tau o le pe ona fa fonga mai le folsanga ali fo mai tamai li ma tamai tai fo mai ia wa iai foi le si tatou vaenga le wa fa maunia le mo le fa mai o le COVID ia sa ola fai tau ia e fasu lima I latou wa mautinoa wa positive ia o le totelo numela le tolus fulmontu ia o le historical cases ia o le ua tapena pea le tatou officer ina ia nofo esia ia tangata ia ma ia pui ai o tatou atunu o le whamtalanga na I tūlanga o tatou malanga lea na taunu mai la sulusu fitu o le whiau I le tatou atunu pa ia mal malu o tupu mai mal malu la whainga luenga ia lava pea le mau pele to vai tatou whatutua I le atua whatutua I ngā luenga o lo whiangai ma lima tamai tai fo mai ia wale puipuinga o le tatou atunu ua tatou iloa mo tatou silafia le whaingatā o le nei whamai tele foi ona aunga ese ia lea foi lau o mai lesi aunga fou nei ia e whai lava sina whaingatā foi ia ai talo ina ia lava pale pero tatou atunu a o tamawhai a li matamai tai fo mai sa ili ase a wala e pui ai tatou ia e whapena foi si tau talanga e fia tu atu I le mamadu o la tunu o lo nofo e sea ia tatou nofoanga quarantine I whaitali malo whatu a inga ia e mese foi o nofoanga ale mtanga duenga ia e mamoli atu lava malu puenga pe a whai ua le tusa foi fuafuanga sa whamuemoa iai le sunga I whatonu ma le malu o le ofisa o le aso le nei no fuafua tu ua ai le tatou no fu sea ia e peitai le ua to silsila ma whaafonga ia o le ua iei nei mea fau tutupu ia lava pele on sai o te iloa e le whaingofia le nofu puipuia ua mai au na o iai le fionga kovana o iai fo i le o se mea whaingofia ia e talo ina ia o tō malamalama pea ma nofo malamalama ma le onasai o lo whaopopo nisi aso o lo o tō nofo puipuia ona o le nau lava ina ia puipuia le ngata o tō ia e mesi o le lautele o tatou atunu le o me lea e tau noa atu ai whapena e whai masui o le fionga le kovana ia le manu e moli atu lo ma ua nganga e whamalulu atu ia matitalo ina i o tō
lava pale pea mo on sai lango sua foi le ngaluenga fo mai ia awale tang fai e puipuia so tato tunu ole tulanga wa yaile tato fa mai nei ia lewa talano atu le sunga fo mai le tawo le fai tui ia ole tangia le pu mate malumul pa io tato tunu ia mai fai tato tui o lewa la tuai luma inu mera le leile to tele o la tunu ua o talia le vala au ma afio mai e fatino le tui puipuia ia lea foi o mai le fautuanga li fo mai ia o tatau foi ona fa popo le si tui e tolu ai tui ia mo i tatou ia wanga vaa ia e le lo le afio mai e puipuia tatou mo tatou whanau ina ia awane iai se whale tonu. O lea foi ua to ia o tātou atunu i lesi wha mai fōu nei o RSV pe ona talanoa atuai ali tabaitai fō mai. Ia o lea nganga lava nai tasi. Ia awane i whapapole ina vale o tātou atunu. Ia nofo puipuia ma nofo vava aia. Ina ia puipuia o tātou whanau mai le pepesi o le wha mai. O lewa ia ili fuafuanga, ia lo fiso soifua malolo ina, ia wha malolo ai nisi tūlanga o whale tausi e tātou whanau. A wā wha mai e ala na pisi o le tele o le whewai, ia o le miana e lava mai pēlo o le sai, ina ia tātou nofa puipuia, ia iai lava le talitonunga, ia lofa pēle atua ia Amerika Samoa, sa foi se aso ia ona wha pēle o na mawatu na wha mai. Ai ele manatu le afa ngata mai East Tautalanga ia e tuatu lo leva noa i le tato tustala ia mo ni la to fisili ia e fa mamlama atili ai le taupu ua tal noa tuai li fo mai li mata mai tai fo mai le ia so fatai.
Thank you very much, Lieutenant Governor. Dr. Ifili, please, I just wanted to clarify, in past time that DOH has done press conferences on the COVID cases, there's always a breakdown on new positives and then the historical. So as of from this flight, how many are actually new positives? And how many are in isolation? And when are the passengers in quarantine will be released?
Thank you for the question. As mentioned before in my talk earlier, 4 positive cases were identified in the first testing. All 4 of those are new cases, and they've been isolated and currently in our isolation facility. In the second testing, there were a total of 38 individuals that we identified as positive from the testing machines, but as we all know, there's always this thing called the historical positive. Those who were positive within that 9-month period can still shed the remnants of the virus and still be picked up by our machines. However, you know, whether they're infectious or not, it's very unlikely. We also understand that with Omicron, there might be some immune evasion. However, reinfection with this time frame that we are now defining as a historical positive, no longer within a 90-day period, we brought that down to a 60-day period. So anybody who was positive previous in that 60-day period, those are individuals that we're identifying as a historical case. So to answer your question, all 15 that were tested positive from the alternate care facility and at the Fatu'āinga hall or quarantine site, because of their lab values and their documented historical case, they are now, I mean, their previous positive test date, those individuals, we're classifying them as historical cases. For the 23 that were tested positive from the trade winds in the second testing, 16 of them we have documented dates of being previously positive. And with their test results, looking at their CT values, we're considering those as historical cases. The other 7 of the 23, we are currently doing other tests to assess, and also through interviews to find out, their status. So those, as soon as we get those results, we'll be sure to inform you all. For the 3 quarantine staff that tested positive during the second testing of yesterday, those individuals were confirming that it's new infections, and they have now been removed from quarantine and are now in isolation. Hope that answers your question.
Total altogether, sir, sorry, we just wanted to make sure we get our data correctly. So for the 4 from off that flight on the 27th are new, and the 3 quarantine staff, that's 7. Isn't the government concerned with the local transmission of the disease with this quarantine staff, and what has been done to protect the community?
Yeah,
besides getting vaccinated?
Yeah, so with our, as we explained our quarantine policy process from the beginning, everybody coming off that plane, they go straight into the buses, and from the buses, they are taken straight into the quarantine sites. Now, at these quarantine sites, they are processed, they are escorted straight into their rooms. Each traveler, their room has, they've been assigned a room before they arrived, so we know exactly where they're taken, and they are then, nothing is done until they're inside their quarantine rooms. Then we finally do the processing. So in that time period, they are being isolated. Each, if it's a single traveler, we try our best to accommodate where they are in their own rooms, and then family members can room together. But however, because of the high volume of travelers coming in and the high number of single travelers, unfortunately, we couldn't accommodate that, and some of these single travelers have been roomed with somebody else. So that's the process we have. And also, our quarantine staff, once the quarantine starts, that staff goes in, they do not come out. They don't go home. We try to make sure that they follow the policies. Of course, with our staff testing positive, we are reviewing and doing investigation on why that happened, and we will be doing retraining and also looking at possible disciplinary actions for breaking our policy, quarantine policies. So we're saying that it does happen. Omicron variant, let me say, it's very, very infectious. With more than 45 mutations of that S protein, it can travel pretty quickly. So, we can expect that some things like this might happen, but we are going to do our best for future flights to make sure that there's retraining and making sure that our PPE process is done correctly to move forward from there. But how long we're going to extend the quarantine at this time, we've already extended it to 10 days so that we can squeeze in another testing just to make sure, so we can look at the laboratory values and compare it from the previous test that we've done, the first and second test. And then if things are well, we'll assess from there whether we need to extend it further or not.
I promise one more question, and I'll leave.
You don't have to leave. You can stay.
I promise I will never bother you again. For the RSV virus, is there any numbers from LBJ or DOH, the actual number of patients been infected with the virus?
Thank you for your question.
I mean, it would be really nice to have some data.
Yeah, I'm sorry, we did not, we lost count. Because that's how much cases are coming into clinic. It's about 90% of cases coming in. So there are patients who would come for simple sores, and then the next day they would come in with symptoms of RSV. That's highly contagious disease. So we are trying to inform the public, please do not come to the hospital if you only have mild symptoms of flu. If you have symptoms of shortness of breath and poor oral intake, then it's time to come and be evaluated. We can accommodate phone consultations just to bridge the gap of coming in physically into the clinic and address the concerns of patients. But we'll look into that, but we are just overwhelmed with the numbers right now. Thank you.
I wanted to add to that, at the emergency room and at the pediatric clinics, like what Dr. Gayapa is saying, the volume of people coming in, it's hard to keep track of. There's a lot of individuals. But we can also look at how many people are now being hospitalized. Now that number compared from last year, it has really increased in just a short period of about 2 months. We're counting more than 65 has been hospitalized for RSV at various clinics, wards. And like what Dr. Gayapa is saying, majority of those that were hospitalized are 5 years and younger. But among the 5 years and younger, majority of them are those who are 2 years and younger. So it's among the children, and that's why we've put out a directive, and then even asking the Department of Human and Social Services to please help us out. And we're starting to close the daycare centers starting Monday for about a week to see if that's going to curb the increase in the number of cases.
Honorable Lieutenant Governor and everybody else. So I'm just looking at these numbers. That's a lot more cases in this particular flight than we've had in the last 6 or 7. I mean, it's like maybe 1 or 2%. And now this, if you look at all the positives, whether they're historical positives, I mean, I just hear positives, and I think the general populace does and goes, whoa. I mean, at first when you guys dropped that number, I thought we were still talking about Samoa and their cases. I didn't think, because it's used to be like 2 to 3, but now we're in like 10 to 11%. Will this increase in cases and the RSV, it looks like you've got 2 problems that you're juggling right now. Will that change at all as far as the threat level that we're at? I know that we're at code blue, right? That's the one where there's no lockdowns. Will there be anything instituted like that in the coming days, given you've got these 2 different variances in both these illnesses?
I'll start. It depends on, we will listen to what the recommendation of the health community is. But right now, in terms of the COVID situation, it's contained. It's contained, yeah, there's 45 altogether, 31 were historical, so that means 14 are active new cases, so that's reasonable. But we will take it day by day and continue to monitor the situation. The actions are being taken to deal with the RSV as well. And like I said, we're comfortable with the procedures that we put in place to cover the COVID situation. And as long as we continue to follow those procedures, I'm comfortable that we'll be okay.
And as far as the numbers, you're looking at maybe total vaccination rate, I guess across all the different demos of about 80%. You know, some people got their shot, some people got their booster, some people only got 1. But you've kind of been staying at 80%. What's the magic number, if I can use that cliche, that the population needs to get to before you can kind of relax those border controls? Because right now, I mean, if you're trying to come to American Samoa, there's 1 flight I think you can get on in April, and outside of that, there's no way to get here unless somebody else does not come on a flight. So the borders are virtually locked right now. I mean, they're not locked, but they kind of are. What is that magic number to there where you would relax that and have more regular flights?
Probably let the doctor.
Thank you for the question. As far as a magic number is concerned, I'll try to address that. But whether we're going to move to relax some certain things, that will be left to the task force. The magic number that you're most likely referring to is whether we have herd immunity. I know we are chasing 90% right now, fully vaccinated for the entire population. So that number there, when we look at different USAPIs, U.S. affiliated Pacific Islands, it confers some type of protection so that the virus doesn't spread as fast within the community. However, the data that are coming from places like CNMI, Palau, Guam, where vaccination rates are pretty decent. In Palau, it's probably got the highest vaccination rate probably in the world. However, the virus with the Omicron variant, it's still spreading pretty quickly. Some of the experts up at CDC that I constantly consult with, they are saying that that concept of herd immunity is no longer a concept with this Omicron variant. And the reason why they're saying that is because even among a fully vaccinated population, that virus is still maneuvering its way through there and finding those who are unvaccinated, and those are the individuals that we're concerned about. Full vaccination with a booster, data is now suggesting that it's really, really protective against severe disease, hospitalization, and death. A recent study that just came out of maybe just a few days ago from California, we have it here on the board, looking at the cumulative incidence of the coronavirus disease among those who are unvaccinated, vaccinated without a booster, and then vaccinated with a booster. The incidence, look at those who are unvaccinated. A lot of the cases are occurring among those who are unvaccinated. But however, there's still a number of those who are fully vaccinated and fully vaccinated with a booster that are also getting the disease. They're catching the virus and spreading to others. But what is the difference? The difference is among those who are vaccinated with a booster, their chances of severe disease is much, much, much more decreased. But if you're vaccinated without a booster, you're protected, but there's still that chance of you getting the disease and getting hospitalized. However, comparing to those who are unvaccinated and you're afflicted with Omicron variant, now your chances or risk of hospitalization is over 1,000% more risk. So that's why we are urging the public. The data is now suggesting that a booster shot will really, really protect you from severe disease and death. I hope that answers your question.
So you would, if you have the shot and the booster, you'll get coronavirus, but you just won't get as sick from coronavirus. Whereas if you're not vaccinated at all, you're going to get coronavirus, and your likelihood of getting sick and having to go on the ventilator and possibly dying is increased. Is that right?
Yeah, you articulate that a little bit better than I did, but yes, that's what we're seeing. Fully vaccinated, you can still catch the virus and get sick, not as sick, but if you're fully vaccinated with a booster, your chances of severe disease and hospitalization is much, much less compared to those individuals who are not.
Now, the remaining 20%, though, that we're kind of working towards to get them vaccinated, have you figured out why they're not getting vaccinated? Is it a religious thing? Do they just not? I can't think they don't know about it, because, I mean, you've been on my radio show for the past 2 years, telling people, and we've been having this conversation many times. So at what point, I guess what I'm saying is, do you say, these guys just aren't going to get the shot, and if they don't want to get the shot, that's their choice. Life has to move on. When do we reach that stage?
Well, at this time, the Department of Health and the American Samoa government, we are doing our best right now to provide access to these vaccines, and also putting in programs to entice people to come and get the vaccinations, because we believe that these vaccines are the way to protect our population. Now, we see also that with the flights coming down, the Omicron variant is knocking at our door. Actually, it's banging. It is banging at the door. It wants to come through. And once that virus comes through, we're seeing that it can still maneuver through a fully vaccinated population. Now, what we're concerned about is that once it reaches somebody that's unvaccinated, it's going to cause severe disease, and there's still that possibility of our hospital being inundated with COVID-19 cases. So we are urging the population to please. We have the vaccination sites out there. We have the $100 incentive for the 5 to 11-year-olds. Come get the vaccine and come get that booster shot.
Is our hospital ready for surge in cases? I mean, we've had about 2 years to prepare. We've gotten several billions of dollars in funding. Are we ready for a surge in cases should, as you mentioned, God forbid, the Omicron get here?
The
That's very
Dr.
secretive.
Gayapu? Okay, we'll try to, we don't have the rep from the LBJ hospital right now, but what we can say here is that we have, therapeutics that have arrived from the U.S. That can help us with those who are affected with the virus and have symptoms among those who are unvaccinated and vaccinated as well. We have the means to do that. LBJ Hospital, they have a respiratory COVID-19 ward where we can, put those who are individuals that are affected with the virus separately from the rest of the hospital. And we also know that there are ventilators that have been brought down here to be able to help the patients with breathing issues if it does ever arise. And also we know that we have oxygen tanks. We have more that's coming. FEMA is helping us out with that. And we also have the means here to produce our own oxygens. So I would say with that, we are as prepared as we can be.
One last question, and I'm sorry for hogging up the time here, but you're following data, we collectively are following the data that was coming out of Samoa, that flight from Brisbane, and we were saying, whoa, that is a lot of cases. Because it's usually 2 to 3 cases, like maybe 1-2%. And now it looks like, geez, it feels like half that flight has corona cases. And then this one, the one here from Hawaiian Airlines, that one has way more cases than we're used to as well. Is that due to the Omicron?
I think that would be a really good bet, and I would say yes. If we look at the data that's coming out right now from WHO and different countries throughout the world, this is the highest number of cases we're seeing for COVID-19 than any other time. The surges in cases is just skyrocketing. The data from WHO is saying over 3 million cases per day, just in one 24-hour period. And we look at the news, what's going on in Hawaii and other states in the United States, there are surges everywhere. So of course, if the number of people that are getting affected from the Omicron variant is going up, the probability of our travelers coming down who are catching the virus either previously or currently is going to skyrocket as well. Same thing that's happening in Australia and New Zealand. With Samoa, I think this is the first flight that they're dealing with an Omicron, cases coming through. And for us, this is probably our first one as well, with this many Omicron cases occurring in Hawaii. So with that information, I would say yes, it's probably most likely due to the Omicron variant surge.
And sorry, one last one. I just want to ask about the doctors. I understand that the other night I got a report that said that there were 50 cases, children's cases of RSV. Let me clarify that I'm asking about RSV. There are not 50 new cases of COVID at the hospital. 50 cases in one night of RSV, though, and that's obviously put an undue burden on our doctors. Are there any reinforcements of new doctor staff, be it from the DOH or LBJ or nurses, to support what you guys have in place so that these doctors don't get burnt out at all?
Thank you for the question. For DOH, we just hired 3 new physicians to help out with COVID-19 and all the other clinics. But we still need to recruit more, because if all of these physicians are, get RSV or get sick, we don't have a pool of doctors where we can to rely on to cover if the current physicians or the current doctors are falling sick or something like that. So we don't have. So we still need to recruit more physicians for DOH. And same thing with nurses. We're short staff of our nurses too, and so there's still this need to recruit more in order to cover not just the clinics, but all of this, the pandemics, if there's a natural disaster and all that. So we still, and also we have the after-hour clinic we're working together with LBJ in order to take other patients from there so they don't go to LBJ on Tuesdays and Thursdays.
And that'll exclusively address RSV?
RSV, yeah, on Tuesdays and Thursdays from 4 to 8.
I see.
And also, John, we're urging the public to please, whenever we fight a disease that's spreading within a community, it is a community effort, not just LBJ or DOH or the American Samoa government. We're urging the community, if you have any symptoms of coughing, sore throat, runny nose, to please stay at home, go through the proper hand hygiene, so that we don't spread the virus. And we're also asking, like I said before, Department of Human and Social Services to close down their daycare centers, because majority of those who are being hospitalized right now, coming to the hospital, are those children 0 to 2 years old.
Okay. Thank you very much for answering my questions.
I tangata ia na whaamaunia mai o tangata ia na whaamaunia e tūlanga suenga. Lea na lātou talina wai ele option A fo ile whesiri lo ilunga talofa pass. Whapea pena maua mua oe i le COVID pena whaamaunia ni au suenga. Mo i lātou la ia lea o te loe i lātou na tali whamai le i maua mua. Ai peta e o mai nei e whaamaunia suenga. A leo o whailo mai e toa fionga o i lātou ia o historical. E la se fuafuanga le malo i tangata nei as in boni whasalanga po tūlanga whapena ona le whaitetenga o le me mua ia e leo tautara sa au mai i lungo o tātou sili e tu inatu ia o le melo na lua foi ia o tangata lau telo tātou atunu nei te iua tatala atu itua ia aia whaina ele malu lau telo la tunu o le tau whai tātou e puipuia manuole o mole vanua le fionga ko vana lutena ia po to fionga vo
ia ele i saunoa le fionga le po le sunga le lutena ko vana o le mata opule i fatsau i tangata e ape tau tar sa pe a fa pe wolu talo fa pes ele na paule ole flight what to wait o flight o mai tu nai to tele atanga ele o sao ia fo ia am salanga tu lunga talo fa pass alo so fai ama tanga luenga me se foi la to Hawaii e fa tu ina tanga ia tama fai ia tu sao fa salanga tsauna ia I lunga talo fa pass e fai ngo fi fo nga luenga ma tau matanga luenga pe fa pe sa fa salanga lo tu lunga le talo fa pass mo se fa salanga ia ele o elo mato malo sila e me fa sala tanga sa ono le tau tala sao I lunga talo fa pass ai ole a tu atu lava no ile
ole whakaimar sili ole tali yoe e il famu e moe al malo e fai tūlanga ia o uma foi ona tusia il polo ainga le fionga kovana o tangata uma ia ua mautinoa ua le whamaoni ia e fai ona tu atu la tu suafa i lo ia sili ia ona fufu ai lai o lo manino lava le tula fono ai le whamaoni ile talofa pass ia fai on fasala oi pe a mautinoa lau le fa maoni lunga fa sinonga
isi au sili fa mole lau fiona ko wana lutena ia o ia foi le lo fai ma te fono tato komite le covitis fluiva mole mai le amatanga fai nga malanga ile nga mai Amerika Samoa sa saunga le mu ila uia mai tau sa saunga le mu le tele fai nga malanga ia ta o repatriation flights ona sa iai le fasa valinga le tatum tanga luenga me se fo le malo e quarantine tangata I Hawaii ina ia fai e suenga a fata se ma le staff lo iai o ia na fto a nga I mai leo tangata ua wha maonia e leo maua I wha mai ta tonu ia le mai tau lina teimi sa saunga le mul tato atunu ulve I le wha ngasalong o ye se fufuanga le tato malo ia me se fo le mtanga luenga e toi wha a wau tūlanga o le quarantine process I le stete Hawaii e peo na masani e ia whainga malanga wao lisi atangata e umana whai nei suenga ia nā lua tuale I le po whēr whale o loa Walmart ma whea tūlanga whapena e whai whaatau ia nā o soane le lungo le waalele sau ia toi wha maunia I nei pe se fufuanga I le tūlanga nā wha mole lau whionga
whaftai mo sili ele eisi tūlanga e toi fo I tātou tua tātou o I luma e leo toi mwhai o tātou na toi o I tua e whai tūlanga na o le sa mawhai ona tātou whai ai vai teimi o tā puni foi a wai. Mo fa tel malo em fa ona fo de fa nga malo ta to. O te minei a to sa to e su ese hotel li Hawaii fa tino ele fa mo mo. Ya ele esta to jupe nga fai melo no lua. O ele o sila fia ele mamalo le atu nu le fa nga ta ole. Tulanga na fai ele mele a ta to ya wa. Mantua ele ya se ya miksa mo I fonu Hawaii. Le se leo miksa mo e o tu leo ina nei faltan malo sa ta tu fa ma ina. Ya ono le alofa tu no so tele na so ani mai. Na fai e ona fai. Ya o tele mana ola ta tu o I tua ma tau fai tu langa. Ona e fai lava sina fai ngata ele ngata o le tupe al fatino ino al famoni moi. O Hawaii o le State of America e ilona ko vana o le lutena ko vana e ila to leo ya ele me fai no atu tatou fai tu langa fa pea e no fo pui ai tangata I se lau ele ese tatou ai ya e masalo na fai ona fai ya ono le no fo malama fo I ma tu langa sa ya il fa ma ina tu langa ya le temine ya lewo ma fai e tatou na fa tino ina fa mo e tonu tatou lava ele ya ma tatou fai e uma tu langa o fa salanga me pena ya ai fa tai tele mo le sili le ai o tatou ta te anga I luma ta tele to tua fa tai
ta se la sili fa mo le la ile sa fa maunia mai sa mo sifo le malo sa mo sifo wa pasi el capinetal tulanga o le toe talai o whainga malanga I le vau sa mo e lua. O i se fuafuanga tulanga o le pe a ona taunu ule tulanga o te loa lele I se tulanga o talano ine I tato malo ine. Ia a ona taunu ona o lewa i fo I tulanga o cases o lo wha maunia mai apia. I si swinga wa o te loa pe lua se fulfai tula ea le quarantine sa masani ia whainga malanga mai apia ia po le lua I tu la fo te le lopo fea tono o quarantine process na masa nele va o pia ma tutuila e se fuafuanga al tatum tanga luenga e pol malo foi e to sui ai le tulanga pe aona to talai le vale o Samoa lua fa molmod
Tala mo city ya pe sa salan o mata pisa salan no ina task force na lo wale no fa vai o tsa malanga mai apia nei wana o tulanga wale to e no fa vai ai ona o le ai no oni mai covid fulu vai mau ia pia ma te milane la o ia fo ia cases apia a fa apela to tsala le fa malanga va o ia fo fuanga al matanga venga la to no fa vai ia tsa malanga mai pia pe ama se limaso pe a fa apela fa tanga ina le to foi o mai o tsa te va o pia ma America Samoa na va fa sai
dai
o le se fa popo tu le tulanga o le vauta toma pia ya e fufua lava I le tau fufua I tulanga o lau to te tala fo I malanga ia pia mai usila ya pois o lo fa penana o lo ia ile fufua lava I le fautranga mai fo I forma e toi fia matalia ia malanga I polu a fa pe tu sama tulanga o ava no o fale no fo sea tulanga fa pena fia matalia vai as phone se malanga e tasi pe lua e se malanga e inicio la tunu o lo fia o mai nei fa pe foi tangata nu o Samoa o pio leolo o no fo nei e pe no fa ya tu e fufu lava I tulanga o le o tapenanga tatu whainga malo o le o te loa e ia nisi na fsilingia le vaale o le Lady Naomi sa whainga malanga mai la stofi ia o le Lady Naomi te mine pe ia o vaa ia container ia e o mai o loa sa wā tu mai la o mai leuka ia on to fo ia la ia le ngisi o mai lalo le ngisi o ilunga ia o le tulanga na la ia le Samoa ele o intanga to fai malanga mai ai ia o le tulanga foi o Samoa ia e mo ia na ia le lockdown na fai le vai aso o tu ia ele o whaamaunia se mele tau le community spread. O lona winga, ia tusa sa mua ma tātou, o lai o loo solo manuia pia, ai nofo pui pia tātou, o le tūlanga na o loo iai le vāo tātou ma sa mua, o le nau ta inga e toi fōi tātou se tūlanga e whai on tātou whamālanga i pia, a whai lava o le tūlanga lea e mai tangata mai sa mua nofo mona i asu. Ia e fuafua, wai o tau tāwhoi tupe e whai e fuafua, tino e fuafuanga, ia e peo no tōse fia o me tā ua lava pui o tātou tunu. Ia o le whapopo atu le tali le tamai tai whamai.
So, siri a le sunga ia John Tufa mo le lava. O ie se fuafuanga i tangata whainga luenga ia tātum tanga luenga lo ia i tono quarantine sites. E ave ese mai ma le quarantine sites ia e fesu ia e atu manisi tangata ia e o fo ilai whainga malanga o e lua manga o la fasiri mo le whainga malanga ia o fuafua ina ia so whaatulanga ina. E ie se fuafuanga i toi sui atu ona o le tūlanga le extension o tātou quarantine mo le ia o mai ai fo i ma fasiri whaatai mo le vanoa.
Tu mai le fasiri ia i lau nei tangata la tom whai atu. Salo e kaunga e sau e whaile plan o kako o quarantine. Well, that's exactly what we're doing. O le sifi le tonu temi nei le quarantine. O le au mai ese la tau tu i le whale le whaanu wha ese ai tāwhuna. Ai ai le sifi fau le la atu ai tonu wal pōlenga. E le o mauti no leipo le ale pesi wha mai tonu le au ino le quarantine site. Ia whapea fo i le au whenga ruenga. Ia o le ngangalanga a faila a siri la fa pe faila ele por mele a sui le alunga ka ko fainga malanga ia ele o ese malo si ele au ngei fa kai
tai
Solo que bien algo le que ko ko ya no ma tule wa ko ni una no a por ko ya mama
Thank you for this opportunity on behalf of the FONO. We are strongly supporting the fact that science, data, and standing united will ease our burden. One of their concern is the fact that, with this RSV, those who are anti-vaccination, there's a drive that the community is coming out with the misinformation that RSV is a prerequisite to COVID. So that should be, we should be aware that there is misinformation. They're just taking advantage of this RSV saying that, oh, COVID is already here. My question to the medical team, since there are 31 historical cases and we hear the contact tracing, is there a possibility of the historical cases to be active again? And what are your efforts with regards to contact tracing? And the other question for me, is there an effort of CDC in terms of 4 years under, with regards to this highly contagious RSV, that there's a move to also get the 4-year-olds under to be vaccinated? And I think that's the concern and also the inquiry that some of the FONO members are asking and wanted to clarify with regards to contact tracing, and are these historical cases, is it possible to have them active again, and how to prevent this from being active? So because I know that these historical cases will be released out in the community, and what are the chances of the contact tracing to detect these historical cases? Thank you for the opportunity.
Thank you for the question. I'll attempt to answer those questions. Really good questions, and I understand that a lot of the people in the community probably have the same questions. I'll try to address the RSV question first, whether there's going to be a vaccine for those who are, 4 years and younger for the RSV. Currently, there is no known vaccination for RSV. There are several companies, I think, according to CDC, that are working towards that. But currently, there is no vaccination for it. RSV, like I said, it's a very contagious disease that can be passed around really quickly. It is very common. Actually, we get RSV here on island probably 2 or 3 times a year. It's just that at around this time, it has reached a certain level that we're considering it beyond what we're normally seeing in previous months or previous years. So that's why we're calling an outbreak. And the reason why is because we want to protect LBJ. For those who get the RSV, those who are 1 year or less are at higher risk of hospitalization, and even amongst the adults who have compromised immune system that might need hospitalization. So if the virus is now spreading to a big portion of our population, the number of those that might require hospitalization rises. And so we don't want that to happen at our LBJ hospital. And also when we're preparing for a possible introduction of the virus and COVID-19 virus in our population. We don't want to deal with 2 things at one time. As far as the historical case, I don't understand the question as you're saying if it's going to be reactivated. If you're referring to somebody that have remnants of the virus in their system that might then replicate in their bodies to infect somebody else, the chances of that happening is very low. A historical case, what we're saying is somebody with documented evidence that been infected in the past 60 days who were infected with the virus, and after a number of 21 days from that last positive test, the virus is, they're no longer sick or no longer infectious. But however, because the body is still doing the job of trying to get rid of that virus from your system, it's lysing up the virus, and all the little particles of it is still, it might be still floating in your system, but no longer infectious, it's no longer replicating. But however, the tests that we have here are trained to pick up on those minute pieces. They're very sensitive. And so knowing that they've been positive 21 days before they came, they're fully vaccinated, they're asymptomatic, and they're testing with a certain level of CT value in their tests. Using those, we can conclude that this is a historical case, no longer infectious. I hope that answers your question.
Yes. So if the RSV does not have any vaccination, let me ask then, is the CDC looking to have an effort to have COVID vaccination for 4 years old under? And second, with regards to definitely, the worry, you've answered the question with the historical case, and I pray that, that is the case. I know Omicron, you're saying that it has a replication of the cells and the virus, so that's why I'm asking that question with possibility, but now that you've said that there's a possibility, there's non-existence. So, but on the COVID vaccination, is there 4 years and younger effort of the CDC? And then my second question, the booster now is added, and at one time our COVID task force member asked, is CDC planning to redefine what is fully vaccinated to include the booster? Because I know that there's going to be more variants coming its way to the world. That's it from me. Thank you.
Thank you, Honorable. The first question regarding whether there will be a vaccine for COVID for the under 5 years old. Right now, Pfizer is looking to submit that data for approval. The CDC, as you know, and the FDA, their job is to review that. The FDA will review the data for safety use first, And then the CDC under the ACIP, which is Immunization Practice Organization, that body that governs practice in the clinics will review it also before something is fully approved and can be adopted for use. So at this time, the answer is no, but I think in the coming months, there will be something that we will be hearing about. The other question about the redefinition. At the moment, the only definition that we know of and have been given are the 2 primary series doses for Pfizer and Moderna, the 1 Janssen. We have not gotten any updated definition to include a booster dose. However, the data that we are looking at and other subject matter experts that we consult with all the time, strongly advising for the booster dose once you're eligible. Thank you.
I'd like to quickly add something real quickly. Data that's coming from Pacific Island nations and also some states. And I'm going to bring up the story of Palau again. Palau currently has the highest incidence of COVID-19 than anywhere in the United States per capita. But however, if you look at their hospitalization rates and death, it's practically zero. Now the question is, what set them apart? Why is Palau so different? After looking at the data, Palau has one of the highest vaccination rates in the world amongst those who are fully vaccinated. But what's more important is that the percentage of those who are 50 years and older who've already received their booster dose is also the highest anywhere in the United States. So according to that data, the booster shots are what's keeping them safe. In the past week, they're reported on average of over 900 cases per day, and yet they still have 0 cases. And right now they're reporting only 9 hospitalizations, and only 2 of those are actually for COVID-19, but those individuals are doing well. So American Samoa, please, we urge you, as COVID is knocking at our door, it's very important for us to come and get that booster shot if you are 12 years and older. Faftai.
Yeah. I think we're coming to the end of our program. Thank you very much, everybody. A special thanks to our Lieutenant Governor, Honorable Carr, Talawenga Ale, and also Honorable Andrew Samoa for taking time out from your busy schedule to be here with us and bring a different view to our program. And also thank you, American Samoa, for being part of this program, allowing us to come to you through KVCK to bring you update of what's going on in American Samoa by way of the support of the government and what's going on, also what's going on in our neighboring independent state. So, tutuila manua, ta tonu tato wo mai fo isi uyo tato porklama, molia teler faftai, o marfa malo tu sai fo I mafa vanolo tai me mato te atu ai maota malawa awa fo is fa mamaanga tu sai fo ma tu langa o tato fa mai. A sa fo is tengo le nei vai ale vai aso momua, pe apule alofo le atua, na tato tu mafuta fo lunga o KVCK ia fa manuia tele le atua tu le manua to fa soifua.